Where governments are slower to respond, and I think this is where the US comes in, what you see, is a resistance of a lot of these measures. And so there's a fear of these economic and social impacts. So those countries are getting hit harder. So that's one thing, timing. The other thing is there's pre-existing factors, I think, in the US that make it more vulnerable in some ways. So we have to ask to what extent societies have invested in good public health systems, good healthcare systems, and whether these systems protect the population as a whole, whether you have universal health care, for example. So we know that the US does not have that some people do not even have health insurance. And the public health infrastructure has been underinvested. So when a pandemic comes along, you have, maybe not the capacity to mobilize in a quick way. And then the third thing I would say is leadership. So I think COVID-19, we have to remember, is first and foremost a public health emergency. At the same time, it can be seen as a political emergency. And the pandemic is challenging really our political leaders around the world to try and bring people together, to mobilize resources, to get citizens to behave in a certain way. And we're not seeing that in the US. What we're seeing is a division between the public health leaders and the political leaders.